Blindsided by Dr. Robin Fiscus, Doctor of Audiology. Which would you rather lose, your eyesight or your hearing? While not a pleasant question to ponder, most of us at some point have weighed quality of life and disruption. I've always been pretty sure that hearing impairment results in losing one's ability to communicate with family and loved ones to the point of social withdrawal, loneliness, and in a worst case scenario, depression and suicidal thoughts. Whereas blindness may prevent a person from being able to independently drive, read, write, or navigate a grocery store. But at least you can laugh at a good joke. As a doctor of audiology who has helped thousands of people hear better, my connection with patients while on the job provides me with an invaluable personal satisfaction. I consider myself to be a person who is grateful for many blessings. I habitually chant personal daily affirmations, and I believe in the power of one's own ability to affect the outcomes of health and happiness. The year 2020 brought unexpected quarantine, political confusion, and financial distress for many around the world. As a small business owner in Bremerton, I am not immune to this massive chaos. In addition to all of the craziness that COVID-19 has brought into our lives, I contracted corneal disease in both eyes that resulted in blindness. The University of Washington doctors tell me that I have a very rare form of fungal infection called Fusarium that is resistant to most antifungal medications and has spun my world out of control. I can't see, I can't drive, I can't do my job, and this terrifies me. After reaching out to many of my Rotarian friends and brilliant family members, as well as audiology colleagues, I have come to embrace technology on a completely new plane. I can yell and argue with Alexa, and she will reliably tell me when to take my eye drops. I figured out how to use the Google Voice commands on the smart TV. I can listen to Audible books with a snappy request. Siri will call my mom, and I never have to touch the screen. She will also read me my text messages or an entire pad thai recipe. Here is my newest technological toy. Are you ready? It's my old friend, the hearing aid. The Star-Key Livio Edge AI will stream to my phone, and a companion app will provide direct audio input to my ears. I have also learned about a visual accommodation created by a company called ORCam. This little gadget can be clipped onto your glasses and will visually recognize monetary cash denominations, text on a computer screen, or paper, as well as utilizing facial recognition technology to help me know who is in the room with me. Apparently, the ORCam device connects directly with the Livio hearing aid, which means nobody else will know that I'm being provided with basic visual information through assistive communication. The Livio hearing aids cost $6,800, and the ORCam device retails at about $4,000 on Amazon. As a temporarily blind audiologist, I'm the perfect professional to comment on the debate of which is worse. Granted, I don't actually have hearing loss. It is still an interesting perspective. I'm planning on contacting ORCam to offer my services and personal review, having been caught up in this ridiculous and distressing situation. My doctors tell me my prognosis is good, and I expect to be back at work as soon as possible. Nobody plans to be blind or hearing impaired, and my highest recommendation is to have a positive attitude and marry a very kind and compassionate person who rubs your back at night and makes you coffee in the morning. In the meantime, use all the technology available to you, and please give me a call as I will be happy to discuss the many options available. I believe that the essential question of which is worse, to lose your hearing or to lose your eyesight, will never be answered. A loss of any human sensation causes immeasurable distress. Both hearing loss and blindness are rotten options. As a doctor of audiology, I am not qualified to quantify the frustration. However, my personal experience has allowed me a new perspective, and I am here to help you. If you are interested in pursuing hearing aids or other hearing technology that may help improve your own quality of life, I would like to help. In the end, you have to believe things will get better because your mind is so powerful. We all still have so much to see together in this lifetime. A footnote to this article. Dr. Robin Fiscus owns Simply Here Audiology, and her business is open, and she has a temporary audiologist on staff, and she is there to assist also.